Welcome to Save a Life in 1 Hour, a first aid course taught by real paramedics. In this module, you'll learn how to treat a patient who is suffering from fractures.
Broken bones are referred to as fractures. Causes of fracture could be car accidents, falls from great heights, and even bomb blasts. If you suspect a fracture, your objective is to keep that fracture still. Make sure you call for help and wait for an ambulance. If you're in an area without a reliable ambulance service, you may need to splint that fracture, which means immobilising it and carrying the patient to further help. Ordinarily, you will be checking a patient who's lying on the ground for any injuries in a head-to-toe assessment. Any pain there? No. Any pain there? No. Pain here? No. Any pain there? No. Sometimes it's not. Okay, he's got pain. Sometimes it's not appropriate to be pushing on a patient you don't know. In these cases, all you need to do is to ask the patient if they have pain anywhere and to lift each limb and see if they can do that without pain. Can you lift this limb up? Alright, how about this one?
Ow, no, it hurts too much.
This patient has pain. What part of your leg hurts, the top or the bottom?
The bottom.
This part. The patient may have a fracture to their lower leg. If you're in an area with a reliable ambulance service, you may not want to splint this leg, but leave the patient in a position of comfort until the ambulance arrives with pain relief. If, however, you live in a remote area or a country with no reliable ambulance service, you will need to secure this leg in a splint for the transport to hospital. The easiest way, if you're in an environment where you do not have anything to use as a splint, is to simply tie one leg to the other. The best idea is to bring the uninjured leg across to the injured leg like this. Then, using simple ties like scarves, shawls, and if you do have them, bandages, you can secure these two legs together. Try and use as many ties as possible. You can use almost anything for a bandage, but make sure it can be a broad bandage. Use a shawl or a scarf or bits of fabric. Feed them through behind the knees. Once all these pieces of fabric and bandages have been fed underneath the injured limb, you need to adjust them to above and below the suspected fracture site. If your fracture is in the middle or of the lower leg, you need to manipulate the bandage down to below the fracture site and one above the fracture site. Lastly, keep your final bandage at the top of the legs. Now, make sure your bandage is broad, bring it over the leg until they're ready to tie off. Make sure the uninjured leg is right next to the injured leg, and now make your first tie. First tie can secure the two legs together. Make sure you tie your knots firmly so they don't come undone in transit. Especially considering you'll be transporting this patient over long distances and difficult roads. Now we're ready to carry this patient to a vehicle. It's very important in cases of suspected lower limb fractures that you transport the patient on some kind of hard surface like a board instead of a blanket. And now make sure that you have a good grip and you're supporting the fracture site as you roll over. You're going to roll on 3. 1, 2, 3. Now place the board up against the back of the patient, support the fracture site, get a grip of the patient's pants, that's always handy, and roll back. 1, 2, 3. You might have to slide the patient across the board a little bit. Once the patient's on the board, you can go either side, and give them either side, on that side. Get a good grip, and 1, 2, 3, up, and let's go. A very common fracture is the fracture of the lower arm. In a fracture of the lower arm, there may be pain around the region, and there could also be some discoloration, some bruising that you will notice. The patient will not be able to move their arm without pain. Any movement of the arm will cause pain to the patient. This arm will need to be splintered properly. First aid for fractures is very simple. What you want to do is to immobilise the limb. Immobilisation means you want to keep it still. To do that, you have to give the limb some support. You can use an old fence paling, you can use scarves as bandages. But make sure you always pad whatever you're using with some type of cloth or clothing so it's comfortable for the patient. With this fracture, I'm going to use part of a cardboard box as my splint. I've cut this square off the edge of my cardboard box, and now I'm just going to finish it off by cutting this final bit off until I've got What I'm going to do with this piece of cardboard is fold it into a type of splint that's going to encase the arm. I'm going to place something soft in the middle to pad it, and then I'm going to slip it gently underneath the arm. As you can see, this is very supportive on the fracture. Would you be able to hold this? I'm going to ask the patient to assist me. You'd be surprised to know that patients can actually help you in your work. Then I'm going to place 2 ties underneath the splint and tie it off. I'm going to make sure that if I suspect the fracture is in the middle of the arm, that I make my ties above and below the fracture site. When I do my knots, I make sure that they're very tight so they don't come undone. Always being aware that the patient is in pain. Putting on a good splint is going to help with their pain, which is very helpful if you don't have pain relief handy. Now, if you choose, you can cut off the ends of those ties or tuck them in to your splint. Always make sure the patient's fingers remain pink, which means that they are maintaining good circulation. Now ask the patient to support the splint on the way to medical assistance.